So we'll get started. To the first Rural Research Collaborative Learning Network seminar for 2024. My name is Dr. Zoe Michaeloff and I'm the Research Operations Manager at Northern New South Wales Local Health District, and we're one of the members of the RR-CLaN. We're very excited to have Dr. Emily Saurman with us today from the University of Sydney to present on rural health research and evaluation and ethics, a session on where to start. Before we begin, I'd just like to acknowledge the traditional custodians of the lands and waters where we work and live. We acknowledge the traditional custodians' living culture, their connection to country, and their contribution to the life of this region. We pay our respects to the ancestors and elders of the region and to all Aboriginal people past, present and future, and any Aboriginal people joining us here today. For those of you who may not be familiar with the Rural Research Collaborative Learning Network, fondly known as RR-CLaN, we are a consolidated partnership comprising of 10 New South Wales local health districts, the New South Wales Health Education and Training Institute, HEDI, the Tropical Academic Health Centre, which is an NHMRC accredited research translation centre supporting 7 Queensland hospital and health services, the Darling Downs Health and Innovation Research Collaborative, and the Darling Downs Health and Southwestern Hospital and Health Service. The RR-CLaN is a rural-led initiative that aims to provide high-quality research, education and training to healthcare staff working in rural, regional and remote areas. Our aim is to provide you with the education and training opportunities you require to build skills in how to use and undertake research to improve healthcare and healthcare delivery. In case you're new to RR-CLaN or missed any of the action in 2023, we record all the sessions that we deliver and we post them to our own RR-CLaN YouTube channel. And I'll pop that link in the chat very shortly. And if you've got time, go and have a look at some of the sessions that we delivered in 2023, and we'll continue to post and build on this content in 2024 and the years to come. Just a bit of housekeeping, we will be recording today's session, and given the large attendance, we will mute your microphones. And if you don't wish to appear in the recordings, please just turn off your cameras. Please feel free to ask questions throughout the session today, and we encourage you to use the chat function in the first instance. If we have time at the end, we'll open up and open up the microphones and you can take the floor and ask any other further questions. I would now like to introduce you to today's presenter, Dr. Emily Saurman. So Emily is a senior lecturer in rural research and public health at the University of Sydney School of Rural Health for Dubbo and Orange and the School of Public Health. Emily is a generalist rural health researcher and evaluator. Her expertise is in mixed methods and qualitative study designs with a particular focus and interest in access, ethics and rurality. Emily's research is in the arenas of digital health, pharmacy and primary healthcare in rural and remote populations. She's a supervisor to the PhD students and master's students. She's a member of the Greater Western Human Research Ethics Committee, and she's also a member of the Australian Evaluation Society and the Health Service Research Association for Australia and New Zealand. And the long and the short of it is Emily is the perfect person to be kicking off the RR-CLaN Research Education and Training Seminars for 2024. And I'd now like to hand it over to Emily. Thank you, Emily.
Thank you, Zoe, and Gawambana. Welcome, everyone. I'm really excited that you've all come along. I'm starting off, as you can see, with a little bit of a disclaimer and a wink to the crowd, because I'm flagging here that I'm going to be talking big picture stuff. I might use some language and terms that some of us may not be familiar with. I recognize we're a crowd that have experiences that span the spectrum of the new to research, hooray and welcome, and those who've been around the space for a little while. And this might be a fun refresher or just another way of hearing and thinking about research and evaluation. Don't fret throughout. This is going to be hopefully an opportunity and a stable point from which we can all leap off into research and evaluation together. So what is it we're going to be doing today? Broad picture, you know, good 3 is the magic number idea, a little more than that. We're going to start off in thinking about what actually is research and evaluation. Research is typically thought about gathering information that generates new knowledge, solving problems, right? And evaluation is assessing the value, merit, worth of something. We're proving and improving. Some say that these things are distinct and they sit on opposite sides of the room. I'm going to warn you, I'm from the camp that says research and evaluation go hand in hand. I tend to even use those terms somewhat interchangeably. Having said that, if I just use one word or the other moving forward, I'm not being exclusive, it's just shorthand. So research and evaluation, not necessarily unique because we work and use the same methodologies and methods. It's how we come to and think about how we categorize research and evaluation in context and the different types of language and terms that can be used and applied in these spaces. Applied researchers tend to think about research as descriptive, analytic, experimental. Evaluators are looking at impact and outcome, process and developmental evaluation. Us crazy academics do all think about that, and then we also think about that space about methodological and theoretical research, and hopefully some of you do too. But there's a lot to it, and it's about applying how we think about this in context and into the space of the real world. Research and evaluation tends to sit on a spectrum in our minds, from one side being what would be quality improvement studies, not lesser, but more internal. Lots of hospitals are doing this all the time, and as health practitioners on this call, you would all be aware of quality improvement studies. So we go from quality improvement all the way into, you know, NH and MRC, multiple year grants, research activity. A lot of what we think about tends to sit in this middle space. But the important thing in this slide is that underlying all of this activity is ethical consideration, design, and practice. So whether we're doing quality improvement or NH and MRC grants, we're practicing ethically and responsibly in our research and evaluation. So as researchers and evaluators, what might be characteristics of a good researcher and evaluator? And I ask all of you, throw a thought into the chat. If you think of something, I'm going to throw some onto the screen now and say that research is not easy, and people spend their lives studying and improving their research knowledge and skill. Some characteristics of a good researcher are listed here. You guys are coming up with some really good ones. I'm curious, of course, critical, really important flexibility, really important characteristics. And while each of us bring our own traits, research and evaluation is a team sport. We come together, we bring our skills together. And some of our team might be methodological experts. Some might be able to bring that skeptic, questioning space into our project and our team. And it's important to bring all of this together. Are there any questions about that broad space of classifying research and evaluation before we move on? Please feel free to throw questions into the chat as we're moving along. I'll have these moments as we move through, and I'll answer questions that appear as we're going along. So I'll move into designing. What is it that we're doing when we're designing research and evaluation? The question is really important. No study type is easier than another. Sorry for anybody who thinks qualitative might be easy, or, you know, those stats. Whew. It's about choosing the most appropriate design to answer your question, which is why the question is so important. A clear question helps us determine a study type and the details of our project. Who's going to play with us and how are we going to play together? And it also helps us work through those ethical considerations. Why these people and not those people? What are the potential harms and benefits? What are we going to do with the information that we get? So your question is where we start. And what makes a good question? A good question is finer. It's feasible. We have the means, the way to actually action the research and evaluation project. It's interesting. Goodness, it's fabulous if it's interesting to us as the researcher or evaluator. But it also needs to be interesting to other people because we ask ourselves, who cares other than us about this? So it needs to be interesting. It also needs to be needed. Sometimes research provides new or novel findings. Sometimes research is about confirming or refuting or extending on knowledge we already have. And so it's needed. It also needs to be ethical. You're going to hear a lot, it's a soapbox of mine, but we need to be ethical in our practice and in our design. And it needs to be relevant. We have the joy of working in a space where our research and evaluation practice has immediacy. And so by having relevance, we can influence and inform practice, policy, and more. So in developing a question, write it down. What are you trying to understand and do? With whom are you wanting to do that? Where is this going to happen? Why are you doing it? How are you going to do it? And often our first question is huge. We're going to solve the world's problems by our research project. And so we need to narrow it down and get from an idea to a doable question. And to do that, we determine if it needs to be answered. Examine the literature. And I put in there, use your librarians. They are a resource that is so valuable. So look at the literature, talk with your colleagues. Our colleagues also are experts in our spaces and they know what's around and can help us refine and work through our question. And then of course, those questions we ask ourselves. Have we thought through this process of is it known, what's known, is it new, feasible, ethical, and who cares other than us? So we refine our question, and once we have our question, we can work on designing our study. Now this slide may look a little bit scary. Don't worry, it's just here to let you know that these concepts and elements of research exist. And while some of this terminology is more often associated with discussions about qualitative research, I argue that it's relevant no matter what type of research you're doing, because epistemologically, where we stand, epistemology is about knowledge and what can be known. And so if we understand where we sit epistemologically about whether, there's one truth or truth can be a collective knowledge, it guides and justifies then our choices in our methodologies, which then have a logical flow into the methods. And our methods are the things that we do. The things that we do to collect data and analyze that data, which then generates knowledge. So there's a real important logic and connection from our question through these concepts to our output of knowledge and dissemination. Other terminologies and things to think about are paradigms. Paradigms are those theories and social lenses that we explore the data and interpret the data through. So understanding that these exist, whether you're a quantitative researcher or a qualitative researcher, and thinking about that reflexivity. Really important no matter what you're doing, because our beliefs and values have social constructs and can influence our data collection, our interpretation, and our analysis. So good researchers were thinking about these things. And of course, ethics. We're managing the ethical elements of a project. We're thinking about and discussing the details of these ethical considerations when designing our project. So quick pause. Are there any particular questions? What options are there to be supported to continue? We'll come back to that. I'll come back to that one, I promise, Sam. So we'll move on in thinking about then methodologies and methods. So we've got that big idea, and we're sitting here in methodologies, and I kind of think about this umbrella space where you have qualitative and quantitative projects. And while they're different, they're complementary. And so we need to understand their difference, but how they work together. Broadly, quantitative studies, and I'm going to flag here, there are courses and degrees focused on what's coming up, right? So this is just big level overview picture stories. And I encourage you, when you have come through your question and you're working on your design, explore the details so that we're designing and doing quality and rigorous research. So quantitative designs, big picture, numbers, right? Lots of people like to think about it, numbers versus words. But quantitatively, we're also talking about larger populations and statistical significance. We're answering those questions about how many, what, and which. Thinking about frequency and trends over time, associations. Whereas qualitative projects, we tend to have smaller populations because we're going a bit deeper and asking those how and why questions, or even why not. We want to explore experiences and the effectiveness of our work. Then there's this really interesting space to be aware of called mixed methods, because while qualitative and quantitative sit in their camps, they're complementary and work really well together to examine complex questions. And mixed methods is a particular approach where you might have concurrent mixed methods where you're doing something qualitative and something quantitative at the same time, or they might be sequential. And there's reason and rhyme to doing this. And so it's just about justifying your choices in your design. So we're going to jump and focus on some quantitative thinking for the moment. Quantitative designs tend to sit analytic and descriptive. They investigate the relationship between an exposure, a study factor, and a disease or a health-related condition. Descriptive studies document the magnitude or trends over time of health-related conditions and what other issues of interest might be in a defined population. We're playing with hypotheses here. That sentence stating, what is your intended outcome? What are you able to prove? The study of distribution and determinants of health-related states are epidemiological studies, and we hear a lot about those at the moment. Common quantitative methods include database or patient record audits. I think we've all thought in those spaces, and surveys. Surveys are a great quantitative tool. I'm going to get on a small soapbox here and say to be aware that surveys that have open response questions does not mean that they are qualitative. And we can go into the details of why that's the case, but just flagging that, it's because it's about how you explore and interpret what comes through. But when we're designing quantitative studies, there are some things we need to consider. Person, place, and time are key aspects of designing quantitative studies. Really, they're kind of important no matter what we're doing, but they sit in this quantitative space. And then there are, of course, these other things, you know, managing privacy and where we're going to store our data. But who are we playing with? How are we going to recruit representative samples? How are we going to get the answer to our question? What if our population is a vulnerable group? How are we accounting for that? Place, where and when kind of time will data collection take place? How am I going to collect this data? Why is this the best way? If I'm using a survey and I'm using a postal survey, how am I going to manage that postal system? Am I going to have reply paid envelopes? Who's paying for it? All that fiddly stuff that we need to think through. Time. Is this is our data collection retrospective, so time in the past? Or are we doing something in collecting data prospectively, moving forward into the future? How often do I need to collect data? And things like that. So these are the questions. And in thinking through and in our design, we're hopefully then managing for bias in our research. And bias tends to appear in one of these three spaces. Selection bias, so that's how participants have been selected. Confounding, which is an unaccounted for factor that influences the outcome, or measurement bias. That may be because an instrument was faulty or the user was faulty. And so thinking about what are the possible spaces that bias could appear. And bias often gets talked about in the quantitative world, but I'll flag for you, it exists in qualitative research as well. Mentioning qualitative research, we tend to start in thinking about methodologies. Big word for big things. These are this is where we conceptualize our research, and these help us justify our choice for research methods. Thumbs up if I'm going at an okay speed for anybody. Cool. Just wanted to make sure I'm not moving too quickly. So we have methodologies. And there are a lot of methodologies, be forewarned. I highlight a few here only because maybe you've heard about them, or to pick some out. So ethnography is kind of that space of anthropological research because it's about being embedded in the community, in the space, in the context and culture of what you're studying. I have grounded theory on the screen and I highlight it in voice because it's a very particular methodology. Lots of people will claim that they're doing grounded theory. If you're going to do grounded theory, wonderful, embrace it, but learn about it so that you're actually applying grounded theory, because grounded theory has, in its logic and justification, has methods and analysis processes that tie itself to grounded theory. So just be aware of that. Lots of us have probably heard about phenomenology and action research. The fun thing about action research is that it's cyclical. It's this pattern of finding information, bringing it back, testing it, and refining in light of the results, and then doing that again. So exciting things happen in qualitative research too. And as I've been saying, there's that important logic to align then our methods to our methodology, which falls back to our epistemology and our question. Question's important, gang. So when we think about qualitative research, I think we all tend to immediately go to things like interviews, right? But there are a lot of methods relevant to qualitative research, a lot of really fun methods. As you heard, I'm a qualitative researcher, so I'm a bit biased in this, but be aware that there are multiple methods we can choose from when we're exploring qualitative designs and practice. The question we often get in qualitative research is sampling. How many people do I need? And the cop-out answer is it depends. It depends on your question. What are you trying to do? If you're exploring a very specific or unique disease and there aren't a lot of people who have it, your population is probably defined for you. It'll also be informed by your sampling strategy. How are you seeking and asking people to come play with you? And then some practical elements. What is practically possible in the design of your study for recruiting and sampling participants? Some sampling strategies there. One of the spaces for bias, as I have there on the lower right, is being careful about our recruitment and not selecting participants just because we think they're going to agree with what we're looking for. That's a clear selection bias trait. And so part of what we need to be doing is thinking through all these bits and pieces so that our research, whether it's quantitative, qualitative, or mixed methods, is rigorous. And this is important no matter what we're doing. We need to be able to demonstrate that our research has consistency, coherency, and is a real account of the topic, so it's replicable or reliable in qualitative words. It's valid. There's integrity to our findings and our interpretation. It's credible. So our findings are well presented and meaningful. They make sense. Transferable. We want to be able to think about what our research means possibly in different contexts, or even just in another ward in the same space, right? It's ethical. If we're practicing good quality, rigorous research, it's ethical research. And then, of course, reflexivity. So to sum up that bit, because there was a lot there, methodologies guide us to justify our choice of methods, particularly language used in qualitative research, but just as logical in quantitative, okay? Methods are the things we do. So often methodologies and the word methodologies and the word methods get used interchangeably, but they're different. The methods are the things that we do to collect and analyze the data. The number of our participants is defined by our question, our sampling strategy, whether it's quantitative or qualitative. That's how we get to that. Being good researchers, we're reflexive. We're thinking about how our positions influence our data collection, analysis, interpretation, and dissemination. We are rigorous from the start to the end, and that rigor then means our research is trustworthy and useful and relevant to the real world. Again, I think that's one of the really exciting things about rural health research, is that it has relevance to the real world. Any questions about that big batch of information? I thought I saw some popping up into the chat, but they seem to have disappeared. I am going to come back to that question, Sam, don't worry. How do we identify our epistemological basis? Good question, Catherine. It's not an easy activity. It's understanding, so there's a really good, in fact, the paper from which that diagram about epistemology comes is written by Stacey Carter and somebody little. I can never remember their name, I apologize, where they have, it's a little bit of a long paper, but they use examples of, about two professors, Professor Rose and Professor Jeffries, and they sit at opposite ends of the epistemological spectrum. And it's a conversation with their student who's trying to navigate these different perspectives. And like, frankly, a lot of us tend to sit somewhere in the middle. But it's about knowing that it exists, and thinking through, am I coming from a space that says, I'm seeking one truth and there is one truth out there, one far side of the spectrum, or truth is morphic. It can be one thing in this moment, but depending on the information we get, truth could be something else. So you can see how epistemologically those two perspectives can sometimes bump heads. It's more just knowing that it's out there should the question come up. What do I do to become a researcher? You ask questions. As cheeky as that sounds, it's as simple as asking questions, exploring for answers, and wanting to know more. Building a team around you who can help you in thinking about how to find answers to your questions. Thank you, Lisa. Thank you, Zoe, for throwing in that paper. Okay, we're going to move on. Whoops, there it is, a little bit. So we've developed our question. Now, something that's really important and helpful is writing a proposal or a protocol. And I say or because in the social sciences, those words get interchanged a lot. People will say they're writing a protocol, fine. People will say they're writing a proposal, fine. If you're working in lab-based test tubes and pipettes and things like that, a protocol is a very specific document, and those things aren't interchangeable. So I'm just flagging that for you. But if for our purposes, write a proposal, write a protocol. I don't care what you call it, but it's a really important document to write because it clarifies and steps out what it is, all these thoughts that we're working through, our question, the design, the methods we're going to use, how we're going to analyze it, the dissemination of our findings, our plan from A to Z. It also then really helps us with our ethics applications. Because a really good proposal, you can slot in your thoughts because you've thought through all of those ethical things. I tend to tell people about the World Health Organization's format if they're looking for a structure, because it's easy. They give little descriptions of what would go under each piece, so they're handy. That's the reason I use them. Your organization might have a proposal format that they would rather you use that. But these are the sorts of things that we've been talking about and the things that we think through when we're designing and developing a project. So our proposal should show that it's well organized, it's achievable, and it's detailed enough to be understood and reproducible for someone else. It looks a bit, so in our proposal, we're writing it, we're thinking about sample size calculations, feasibility, our recruitment strategy, our consent processes, our analysis techniques and pattern, who our team is. We're talking to them about this as well, but also who are we playing with and why are we playing with those people? We're thinking through all of these things and getting it really clear. And this is a bit of a cycle. You're going to possibly work on this for a few drafts, so don't fret if that's the thing. And as one student said to me, for them, they saw this as 50% of the project. And I really liked that because it's kind of true. If you've worked through your proposal and have a really good proposal protocol, it's then the blueprint for the activity that comes after you receive your ethics approval. And then it's just following your guide. There's no question about who we're playing with or how we're going to recruit them because you've thought through all of that. It's just actioning it and then getting to play with data and thinking about it and interpreting it and finding out wonderful things and making changes. And I'm getting excited. So in thinking about all of this, as I've been saying, underlying all of our thinking are these ethical considerations. Is this research of merit? Does it have integrity? Are we building on what is already known? Have we built a team that has the skills and the competence to conduct this study? Do we need to find partners or collaborators to play with? Is it appropriately designed? We have our question. Does our methodology and our method logically align? Are we able to answer our question using the methods we've thought of? Is there justice in our project? And this includes things like our recruitment strategies. Why are we playing with these people versus those people? What is our inclusion and exclusion criteria? Have we thought about how we're going to share our outcomes with our communities, with our participants? What is the burden that we're putting on our participants, and is it a fair burden? How do we manage that? Beneficence, balancing that risk and benefit space is an easy spot to think about, but also, you know, a lot of projects will have some level of risk, even if it's discomfort. But how then, what are our plans to support our participants should they experience distress or discomfort? Have we thought about the impact of participation? And what are we going to do? What is our action from our findings? What is our plan beyond? Respect. We easily jump to things like privacy and confidentiality, respecting someone's privacy. And I'm going to throw in here a little note that there is a difference between anonymity and confidentiality. So when you're thinking about that, be clear what you're actually which space you're actually able to play in. But it's also about respect for the individuals and their ability to decide to participate, or the social determinant spaces and how we've designed our project to be inclusive, right? So those are aspects of respect. And again, as rural researchers, we have this extra bonus space in thinking about ethics, that how do we work ethically in our communities? And, you know, I welcome you to throw some ideas into the chat about some of the unique things. My mind, being a bit of a qualitative player, thinks about how do you navigate relationships in some of our smaller communities when you're dealing with potentially small numbers of participants and they may know each other? What does that mean for then confidentiality or anonymity? Can't be anonymous. But then if you have focus groups, what is the purpose of your group and how do you navigate bringing certain players together into groups? What is safe? What is responsible? What is respectful in our smaller communities? So, you know, while there are those standard pillars where we think about ethics, we have to step that little bit further and think about also then in the reporting space, how do we share the knowledge that we've gained with our colleagues, with the greater public in publications, respectfully and responsibly. So we're always asking ourselves when we're designing things, that so what? That who cares bit. Have we worked through the ethical implications, the ethics and ethical implications, similar but different things? Have we built a team that has the skills and resources to do the work? And what are the likely outcomes? Have we got through our hypothesis. So we've written our proposal. Don't forget, we're at that stage. We've written our proposal, and now we're going to submit our ethics application. Contact your ethics committee. They are amazing people and there to answer our questions. They also, some committees have an informal, I'll use the term, stream for thinking about those quality improvement studies. So if you want to talk to somebody about your design or the direction you're going, or if you're not certain if it's quality improvement or if you're sorry, I got muted there. I'm back. Contact your ethics committee. There are forms that you'll need to submit. Whoops. There we go. These are the ones that I know about that health tends to use in both New South Wales and Queensland. Contact them, ask questions, give yourself time to be able to complete the documentation that they need for review. Their meeting schedules are all online, so you can plan backwards. If you're going to shoot for their April meeting, work your way backwards, thinking about the different documentation that you'll need to justify your design and study. Something else that I was going to say about that. Oh, that bottom point, really important. Don't proceed in the research activity until you've received approval from the ethics committee. There are committees. Now, some questions. Looking at our participant travel issues. Really good note about that. Generally, but also a really nice note about our base, thinking about social and demographic circumstances. Beautiful, you guys are on this. Easier for patients to be identified by others in a rural community, exactly. And so it's thinking through, how do we protect our participants? And there are strategies and means and ways about this. That's why we work as a team. If you're out there doing research and trying to do something on your own, stop. Find somebody to talk to about it. Even if, you throw your ideas, don't be throwing them against a wall. Throw them to someone who has ears, who can respond back and even echo back where you're thinking, so you can think through these spaces. Resources. Do all types of research need ethics approval? Retrospective studies and case reviews, as an example, yes, those types would. Where it gets sticky is, I tend to play, I'll be frank, I tend to play on the banner that I'm going after ethics, because I want to be able to disseminate and share this information widely. There's sort of this line that used to exist where quality improvement studies are internal only. So they didn't need ethics review and approval because all of that data was staying inside. We're using that information to know how many people came through our ED, for example, to know how to staff our ED, or what types of presentations were coming into the ED so that we can be thinking about managing presentation types. Quality improvement studies. Really important studies to be doing. There's no greater or lesser to any research or evaluation. The subcontext conversation was that if you were going to publish, you needed ethics approval because you're sharing that data, people's information, to a wider population. That said, there are some quality improvement studies that are getting published. I would recommend always thinking about the ethical space and implication of what you're trying to do in thinking about whether or not you're going for ethics approval. I hope that helped you, Anuka, and I hope I pronounced your name correct. Yeah. See, good question. So Jen Syme, having written a program to run with students locally and wanting to evaluate this, at what point does it shift from evaluation into research and need ethics approval? And so that's where, Jen, I would argue that those evaluation and research, that's where they're sitting together. I don't see them as necessarily distinct activities because we're evaluators and researchers. We use the same pieces on the board. We're playing with methodologies, theories. We have the same methods and analysis techniques and tools. It's the language you put around it, which seems to be where people make the distinguish and distinct definitions. Though when you would need ethics approval, I think I may have responded to that, but we can come back to that. How ethics for research in rural can be different. Oh, I hope we've talked about that, Kazi, how ethics in rural is different. Comments about submitting research governance and site approvals. Louisa, there are forms through your ethics committees that help you through that process. It's pretty straightforward, but the easy answer to that is talk to your ethics committee. Again, your governance officer, the ones that I've communicated with, and I've spoken to a few, are great. They're really patient, they're really helpful. They're there to help you get through ethics. Ethics processes tend to have one of four initial results. They green light it right away, which, let's be honest, doesn't really happen that often. Ethics committees can reject. Again, something that doesn't really happen often. It tends to sit in these middle two camps where you receive query to respond to. And the two factors is your responses can either go back to the committee for review, for another review, or the committee has agreed that your responses can be reviewed by the governance officer. Those tend to be the outcomes, but expect some sort of interaction and response. Does a quantitative protocol have to test a hypothesis? Or can it just be looking at a research question? It's a good question, Rodney, I love it. I would say that hypotheses tend to sit with quantitative research, but descriptive studies don't always have a hypothesis. Sometimes we might be exploring a data set and describing what happens. So, but then sometimes we get an inkling about what we're going to find, which is a hypothesis. So it exists, but it may not always be with the H-OT sort of signature when thinking about hypotheses. I'm open to other people's thoughts on that. Thank you, Zoe. So before we get too far, bit of a summary page and some of the points I was hoping came through in those different spaces. That what's research and evaluation? It's about generating knowledge, assessing value and worth, problem solving, proving and improving. And as you can see, ethics is across all of this. When we're designing research, it's about that question. And, we can create finer questions to help us get there. Knowing whether we're quantitative, qualitative, a mixed methods design, and that all of that flows logically through. And of course that we're doing quality, rigorous research and evaluation work as ethical practitioners. Developing our proposal is 50% of the project. You get a good proposal, you are just on after you've had contact with your HREC or your health human research ethics committee. And that I encourage you, if you are new to the space, to examine and explore some of these elements further so that we can be quality rigorous researchers and evaluators in our ethical practice. Yes, have you come back to this question? I have not come back to that question. Thank you, Zoe. Having said that, and looking at the time, I'm going to quick jump and flag for everybody. March, we're going to have another presentation through the RR-CLaN, and I happen to know a couple of the people that are being asked to present, and either of them are great presenters and the topics would be amazing. So mark your calendars, March the 6th, watch this space. And while it says thank you for attending, how did we do? Please answer that, do the little survey for us. That would be great. Zoe will throw the link into the chat. But we'll come back to questions. Please do feel free to unmute or just throw it in the chat. But I do have this question that I've promised I will come back to, which is working part-time with limited hours and often quality improvement and research gets pushed down. I know it. What are the options supported to continue these projects? And Sam was the person who asked that question. Sam, one of the things someone has cheekily thrown in there, harnessing university students. Yep, do that as a, plug. We have medical students, we have public health students, we have all sorts of students who need projects for their degrees. So talk to university partners across our LHDs. We are a fortunate bunch that we have university departments of rural health and rural clinical schools are scattered throughout our regions, including Queensland, our buddies up there. So communicate, reach out, even if it's not, in your town or your neighboring community, reach out to a university partner to have a conversation. I can tell you a lot of my colleagues, a lot of the other university colleagues, they're open to having the conversation. That's where it starts. If we don't have the conversation, we can't find a pathway forward. So yes, think about students, thinking about, as was pointed out, one of the partners of RR-CLaN, HETI, the Health Education and Training Institute, has an excellent research capacity building program that may or may not fit into your opportunity. The other thing, and I don't know, it's tricky because I think a lot of our work there's a time element to a lot of our work and thinking. And so engaging with our partners and our friends in these other spaces are places where we can start. But sometimes if there isn't an urgency, take our time. Have conversations with your research team. A project may not have to be done in 6 months. We don't want all of them to take 6 years, but you take your time. Like I said, 50% of the work is thinking through the design and the development space. So if you're spending your time there, that's important. And then you have the blueprint for the action. Yes, if you have an idea that needs someone to do the legwork, talk to your buddies. It's been my pleasure for all these kind words. As was stated there by Michelle, there's a Master's of Public Administration. I know through the University of Sydney, we have a Master of Public Health students who all have to do what's called a capstone project. Those happen twice a year. Throwing that out there. Yep. Nina, great. Collaborating with allied health, that's the other thing and fun thing about rural health research, or at least in my experience. People come to the table, right? We ask the question, we build the team, people come to the table, and we find means and ways. So if we're not asking, if we're not thinking, if we're not reaching out, it makes it that little bit harder. And medicine doesn't have to do medicine. Allied health doesn't have to do allied health. It's all about rural health, right? We're interested in that bigger picture space. Maybe I'm speaking on a
might have time, Emily, for one more question. Mr. Rahman, would you like to come off mute and ask a question, and then we'll wrap up?
Yeah, this is yeah, I'm from Marmbiti local health district. So I have a question, like, because I need to do some reporting, and sometimes some of the reports are like end season report or annual report are actually interesting, and would like to make some publications. So do you have any idea how to proceed for publication of such reports?
The short answer is yes. I have ideas about how to publish reports. And there's a whole separate talk, I think, in the RR-CLaN YouTube space about publishing. So it's worth looking into that. But the short answer, talk to your team. Who are your team? Who are you playing with? Think about who is the audience that you'd be writing this publication for. Explore where then you would find those people so you can target appropriate journals. Every journal has a guideline for authors. Find the journal, read their guideline, and meet their requirements. But talk to your team. Because what is it? Research is a team sport, gang. So get the people around you.
Excellent. Thank you.
Yeah, my question is, like, the report, because the report is not based on a research, it's a routine reporting we're doing. So, but there are some interesting findings sometimes we get and would like to publish. So that needs the ethics approval and other things. So what do you have any sorts of recommendations to proceed with such report for a publication?
Right. So again, the short answer would be unfortunately, I think this is a conversation that might need to happen outside of this space, but trying to publish routinely reported data because it's interesting, important. Yes, I would suggest putting together a proposal and getting ethics approval to then analyze and tell that story. That's the short answer, but I think there might be more to talk about in that space, and talk to your ethics committee. We've come to time. You guys are amazing. Good questions.
I'd just like to say too, thank you so much for everyone attending the RR-CLaN, and a huge thank you to Emily for today's session. My goodness, was it an overview of research and evaluation and ethics? It was a huge topic, but there was so many gems in there that you provided, Emily. It was a thoroughly enjoyable and fantastic overview session. So please join us and thank Emily for today's session. If you do have a moment, please complete our survey. We're always trying to improve what we're doing and what we're delivering. And we look forward to seeing you in a March session. The topic will be confirmed very soon, so keep an eye on your emails, and we look forward to seeing you in March. Enjoy the rest of your afternoon, everyone. Thanks again.
Thank you. I'll stay online a little bit if I saw somebody's hand went up.